My name is Dr. Truong. I practice in the Dallas-Fort Worth area. I have been using StellaLife recovery kit for about 2 years now. Before that, I use a lot of the chlorhexidine and then the perio-science. My practice is a general practice, but it's focused mostly on surgery. We do a lot of sinus augmentation. We do bone grafting, block grafting, block splitting, and full mouth reconstruction on 4 bridge, on 6. We rely a lot on how the patient heals. So I've always tried my best to find the best product to help the patient heal. Since I have been introduced this product by Dr. Michael Pico's, one of my mentors, I have used this product, the recovery kit, and give it to all my patients after surgery. We actually start them 3 days before surgery, finish up throughout the end of surgery. What I have seen is that my patient have a lot less post-op problems. Pains become less. They use pain medication less, mostly just ibuprofen and Tylenol for the first few days, and then nothing else. When they finish the kit, I always recommend them to go to the StellaLife website to buy more of that if they want to use their daily use. I believe this kit is one of the success that I have in the surgery and recovery of my patient, and I recommend it for every one of them. I highly believe in the product, not just use on my patient, but also help teach and mentor some of the doctors that do surgery. For my patient, I see that whenever they finish the product, they would always come back and ask me how do I get some more and things like that. So it just gives me a testimony that they like it too, and they see the result firsthand. And so, you know, that's one of those things that I enjoy adding to my practice. I use some of the product for the hand sanitizer from StellaLife, and as a matter of fact, when I was introduced to it, I liked it so much, I bought for several of my friends from church, one each, and gave them as a present. They all love it, and so we've still been using it. So that's one of those things that I wanted to be able to give a testimony of some of the use I have for this. And if anybody who has a practice that do a lot of surgery, I highly recommend this.